This was a really important episode for me to record as a nurse, and just with everything that's been going on in the media today, and a lot of the violence against healthcare staff has really taken spotlight. And so this week, I really wanted to talk about violence in healthcare, everything that I've been learning over the past few years, and offer some solutions and some encouragement to not only nursing staff, but other healthcare staff as well. Really been working closely with hospital safety and security for the past few years and really learning a lot. And there is a lot being done, but the violence, I think, is really a symptom of what is going on in our society today. Like, it is much bigger than just what is going on in healthcare. And so I really took some time to reflect and pause before filming this episode. It is a little scripted, but I felt that it was really important to make sure that the information that I was presenting was concise and relevant and actionable, because I think what everybody really wants to see today is action. And so, one, I encourage you to listen and think about how you can apply some of this to your own practice, but also to take a moment to look around and see the actions that people are already taking, because there is a lot of work being done to ensure the safety of healthcare workers and staff and patients. There really is a lot of work being done, and I think we have to acknowledge that, because there are so many just phenomenal people that really are putting in a lot of work, a lot of effort, creating policies, creating, best practices. Like, there is a lot of work that is going on to help mitigate and prevent this violence in healthcare. But it is such a huge issue. And like I said, it's really like a bigger issue of our society, that it's really going to take all of us working collaboratively and putting aside our differences and really looking at what we can do as individuals, but what we can do as teams to really help mitigate and prevent this violence that healthcare professionals are encountering every day, nationwide, globally. It's not just in the United States. It's a global issue that we're all facing in healthcare. So I hope you enjoy this episode. I hope you comment, leave suggestions, leave feedback, leave criticism. I am open to criticism. If you think I misspoke, please call me out on it, correct me on it, because it's in those conversations and in that discourse that we grow and get better as professionals, and also help to solve this problem. Everyone, and thank you for listening to this episode of the Security Nurse Podcast, where we dive into the most pressing security issues in the healthcare industry today and offer solutions you can use today. In today's episode, we're going to discuss a critical issue that is gaining more attention every day: the rising trend of violence in healthcare settings and its impact on both nurses and patients. There have been some alarming occurrences in healthcare just in the past few weeks, from a nurse being beaten by a patient in Florida and will likely lose her eyesight, to the active shooting and hostage situation in Pennsylvania, where an officer lost his life and a doctor, nurse, custodian, and others were injured. From physical assaults to verbal abuse, healthcare workers, especially nurses, are facing increasing challenges when it comes to personal safety in their workplace. But it's not just staff under threat. The safety of patients are also at risk, with growing concerns about how violence in healthcare environments can compromise care. Today, we'll be talking about the causes, the consequences, and most importantly, the solutions. Violence in healthcare is an issue that's been escalating over the years. According to the Bureau of Labor Statistics, healthcare workers experience more workplace violence than workers in any other industry. In fact, nearly 75% of all non-fatal workplace assaults happen in healthcare settings. Nurses in particular are at the highest risk. The emotional and physical strain on nurses can make them more vulnerable, and these stressors can manifest as aggression from patients or visitors. The types of violence range from physical assaults, hitting, kicking, and even stabbings, to verbal abuse and threats, to psychological abuse with harassment and stalking. Nurses are often at the forefront of these assaults. They are the forward-facing staff interacting with patients and their families in high-stress situations. But what's driving this disturbing trend? A few key factors include staffing shortages, long wait times, and patients who may be suffering from conditions that affect their behavior, such as mental illness and substance abuse and dementia. And I think we have to start paying attention to how insurance policy and public policies are impacting grievances and ideology. From vaccine concerns, a growing issue with patient concerns about autism, and then the COVID vaccine concerns, to patients angry over rising healthcare costs. These issues warrant a closer look at their impact on violence in healthcare. A recent incident of this issue is the United Healthcare assassination of their CEO and subsequent outpouring of anger and support for the perpetrator. I think policymakers and healthcare professionals need to take a really long look at the why behind that, and then the massive response that caused concern for copycat incidences. Ultimately, my opinion, and this is only my opinion, is that the violence will worsen for nurses, not so much CEOs. While there may be a few people that will take it to an extreme and target more CEOs, the general population response and anger is suggestive to me that the majority of patients will direct that anger towards the people they have the easiest access to, which is nurses. It's already happening, and in my 19 years of experience, has been the majority of the verbal abuse I encounter is rooted in. Another issue in healthcare is domestic violence. Statistically, the highest cause behind violent deaths on healthcare property are domestic violence related. Whether that is a partner or an ex-partner targeting an employee or patient, the highest percentage of those deaths, though, are employees. So it's really important that we understand the root cause of these violent events, because the solutions are multifaceted, and implementing one solution may address one cause, but not another. This is why we as nurses and healthcare staff need to have a deeper understanding of these issues ourselves. It impacts our safety, patient care, and ultimately the outcomes for everyone. Understanding the health and social issues that impact our patient population give us an advantage to maintaining our own safety, as well as giving the best care we can to patients. Now, let's talk about the real impact this violence has. For healthcare workers, the consequences go far beyond physical harm. Many report feeling emotionally exhausted, experiencing post-traumatic stress-like symptoms, and even leaving the profession due to safety and legal concerns. This leads to an increased turnover rate, which only worsens the staffing shortages already affecting hospitals. It also leaves newer nurses without strong mentors to help teach and guide them. But violence isn't just harming the healthcare workforce. It's also putting patients at risk. In chaotic, short-staffed, and violent environments, there's a higher chance of mistakes, delayed treatments, and breakdowns in communication. Patients who require care in these settings might not receive the quality treatment they deserve because the staff is preoccupied with managing dangerous situations instead of focusing solely on their well-being. The negative impact on mental health, disruption of care, and the safety risks for both patients and staff paint a grim picture of what's happening in healthcare today. So what's causing this uptick in violence to be harder to manage? Well, there are several contributing factors that are important to recognize. Number one is staffing shortages. Hospitals and healthcare facilities are operating with fewer staff, which leads to burnout. Overworked employees can become more susceptible to verbal and physical assault. This isn't just true of nursing staff, but all staff in the healthcare setting. Number two, increased patient acuity. Many healthcare facilities are seeing patients with more complex needs, from severe mental health issues to high levels of substance abuse. When these patients don't get the right kind of support, it can manifest as aggression or violence. We also need to consider that the baby boomer generation, which is one of the largest populations of our time, is getting older and experiencing more health issues. There is concern that this influx of patients will put much more stress on a system and workers that are already working in short staffing situations, leading to errors, patient safety concerns, and worsening staff burnout. Number three, stressful work environments. Healthcare, particularly in emergency and critical care, is a high-pressure field. Long hours, understaffing, overwhelming workloads, lack of community resources, and financial stressors can make both staff and patients more irritable and prone to violent incidents. Number five, lack of adequate training. Healthcare workers may not be adequately trained in de-escalation tactics or how to handle aggressive behavior. Without these tools, employees are left to deal with violence in a reactive, often unsafe manner. Number six, staff mental health and burnout. All of these factors contribute to the mental well-being of staff and can perpetuate feelings of burnout. These circumstances can have added risks for employees, including health issues, increased irritability, decreased morale, and decreased situational awareness, to name a few. All of which some studies show impact the healthcare workers' ability to maintain safety for themselves and patients. Despite the grim picture, there are things being done to address the issue. More healthcare organizations are starting to take proactive measures to protect both staff and patients. Many hospitals are now increasing on-site security, installing surveillance cameras, and implementing panic buttons to quickly alert authorities when a situation turns violent. Many hospitals are starting to use K-9 units in their facilities, as well as forming their own in-house agencies. Some hospitals even have temporary holding cells on their campuses. So a lot is being done, but the biggest barrier to these security measures is budget and staffing. Number two, training and de-escalation programs. There is an increasing focus on training staff to manage aggressive behavior before it escalates. De-escalation techniques, conflict resolution, and behavioral health training are becoming essential parts of healthcare training programs. I've seen a lot of comments recently stating we don't need more training. However, it's important to remember that there really are facilities where employees have zero to little training. There are also a number of organizations offering webinars, including the International Association of Healthcare Security and Safety, the American Hospital Association, the Association of Nursing Leaders, the Emergency Nurses Association, and the Academy of Ambulatory Care Nursing, to name a few. So you can find some webinars online. Number three, advocacy for better staffing ratios. Many nurses and unions are pushing for better nurse-patient ratios to reduce burnout and stress, ensuring that nurses have the time and energy to focus on care rather than trying to manage aggressive patients with limited resources. Better staff ratios don't just help in the management of workplace violence, but studies have shown repeatedly it improves patient outcomes across all aspects of patient care. Number 4, use of aggressive and violent behavior screening tools. Some hospitals are starting to implement the use of clinical screening tools to aid in the early identification of aggressive and violent behavior. Once a patient is identified, then interventions can quickly be put into place, as well as alerting security sooner of an issue or getting a social worker or a psychiatry consult sooner. These tools are most effective when accompanied by clear policies on how to use them and interventions staff are to implement. Number 5, shared accountability. Workplace violence prevention and response in healthcare is not just any one department's job. The most successful programs are the ones that have support and buy-in from everyone. This means C-suite has taken an active role in openly supporting workplace violence efforts, security, clinical, operations, environmental, nutrition, and facilities are all working collaboratively, and frontline staff are taking an active role in their own safety. Shared accountability also means that if we're going to have zero tolerance for patients who are aggressive and violent, then we must hold ourselves and our colleagues to the same standards, not just in how we treat each other. Nurses eat their young comes to mind, but in how we treat patients as well. And unfortunately, I have heard and read countless horror stories on the way some staff have treated patients. Regardless of burnout is the root cause, there's no excuse for the things I have heard and experienced for myself. If we're going to demand better of government, C-suite, and security, we have to demand better of all staff. Number 6, community-based violence intervention programs. Hospitals and healthcare facilities are a crucial part of the communities they reside in. Numerous studies have shown when these programs are implemented in communities, violence is decreased. When we invest in our communities and work with all stakeholders, the positive outcomes benefit everyone. So consider getting your organization involved in a program or just volunteering on your own. As we move forward, it's crucial that we continue to highlight the importance of both preventing and addressing violence in healthcare settings. Hospitals and healthcare systems need to foster an environment of safety and respect for all staff members, as well as for patients. This includes advocating for adequate staffing, improving training, increasing awareness, and implementing policies that address these issues. The road ahead will require cooperation from all levels, from the individual healthcare workers to hospital administrators, and from policymakers to the public, to ensure that we not only combat violence, but also create environments where quality care can thrive without the fear of harm. Thank you so much for tuning in to today's episode of the Security Nurse Podcast. If you found this discussion insightful, please don't forget to subscribe, rate, and share this podcast with your colleagues. If you have thoughts, questions, or training suggestions on today's topic, I'd love to hear from you on social media. You can find episodes posted on YouTube, Spotify, and LinkedIn. And until next time, stay safe and take care of each other.